Back, we are going to be looking at the next topic, dilution and concentration tests. Now, dilution test measures the working of the renal tubules. For less reabsorption of tubules, urine becomes diluted. For less absorption, for less reabsorption of tubules, the urine becomes diluted. So for some reason, the urine, instead of one passing out urine that is okay, becomes too diluted, almost colorless, So in this test, the patient fasts overnight. Patient has to fast overnight, and in the morning he drinks about 1,200 ml of water over 30 minutes. The urine samples are taken every 4 hours. So he drinks that 1,200 ml of water within 30 minutes, and the samples are taken every 4 hours. Now, a urine concentration test determines how well the kidneys are functioning. The test may be used to test your kidneys' response to too much fluid intake. It's also known as water bathing. And also its response to too little fluid intake, known as dehydration. And when somebody does not take in enough fluid, what do you expect? There will be dehydration. So the main reason this test is ordered is to see if there's any suffering from central diabetes insipidus, this is a disease that causes excessive urination. Diabetes insipidus is a disease that causes excessive urination. Now, this form of diabetes can occur when a head injury affects how the brain releases ADH. It affects how the brain releases ADH, which is antidiuretic hormone. This hormone is responsible for the concentration of a urine. So let's go ahead. ADH normally increases the amount of water the kidney retains. In central diabetes insipidus, known as scapular acidic, the brain does not release enough ADH. The brain does not release enough ADH. A urine concentration test can also be used to evaluate 1, we have mentioned it before, dehydration. 2, kidney failure. 3, heart failure. 4, other hormonal problems. 5, complication of urinary tract infection. Complication of urinary tract infection. What we'll be looking at is urinary acidification test. Urinary acidification test. Now, this test, average urinalysis is supposed to be 6.0. The average urinalysis pH. Now, the normal reference range for urine pH is between 4.5 and 8.0. 8.0. So the reference range, normal reference range for urine pH is within 4.5 to 8.0. Now, kidney stones, they tend to form a highly acidic or basic. They tend to form in a highly acidic or basic environment. Then also, urine pH level test. Urine pH level test is used to know how best the medication for urinary. We say urine pH level test is used to know the best medication for urinary tract infection. So I've said some things about acidification test, trying to know how acidic a urine is. Yes. So if somebody's urine is too acidic, it's a problem. If it's also too alkaline, it's a problem. So we said the average urinalysis pH is 6.0, but the reference range is between 4.5 to 8.0. So anything above 8.0 is tending towards what? Being basic, being too dilute. That's dilution, over dilution of urine. Then anything 4.5 downwards to 3 to 2 and etc. Urine is too acidic. So urinalysis, when urinalysis is done, urine pH of a normal person is supposed to be between 4.5 and 8.0, and the urine pH level test is used to know the best medication for urinary tract infection. Now, we'll quickly look at urine specific gravity and osmolarity. Under it, we have Urine specific gravity is a measurement of the density of urine. You know, urine normally is made up of water and some other solutes. So there's supposed to be a normal range. A normal range for specific gravity. So anything short of that is a problem. Are we getting? So that's why urine specific gravity checks or is the measurement of the density of urine compared to pure water, because pure water is pure, there's nothing in it, no solutes, it's pure. So we compare urine density to that of pure water. That will give us an idea on the urine specific gravity. Now, urine specific gravity is determined by using a refractometer. Urine specific gravity is determined by using a refractometer. Then also, urine specific gravity is influenced by the number of molecules in the urine, number of solutes. If the number of solutes are much, definitely you should expect that it will affect the urinary specific gravity. Specific gravity less than 1.008. In such, you see red blood cell, you can see white blood cell. Cast can also be seen. So we have said a lot of things today. By the time we meet in class, we'll discuss more on these topics. We have said so many things. We rounded up with our urine acidification test and looking at urine specific gravity / osmolarity, where we said urine specific gravity is a measurement of the density of urine. So try to compare the urine and pure water. Pure water, we said, is pure, does not have any solutes in it. But for urine definitely contains some solutes. So when this amount of solute is too much, the urine becomes denser. You understand? So we'll see in class so that we'll do more of our discussion. I hope you enjoyed all the lectures. So if you have any question, always feel free to drop it at the comment section. I will look at it, we'll answer it. When we come to class also, we'll do well and also answer those questions better. So God bless you. Bye.